How are you sure that this is so safe?
Because I'm a genius. Hi, I'm Dr. Joubin Gabbay. I'm a board-certified plastic surgeon from Beverly Hills. Today, we're going to talk about tummy tucks versus liposuction and everything you need to know about them. The traditional definitions of tummy tuck and liposuction are pretty specific. A tummy tuck serves to get rid of extra skin in the lower abdomen. It will reshape the belly button and it will tighten up the muscles, those two six-pack muscles of the abdomen. Liposuction, on the other hand, works on the one other component of the abdominal area, and that is the fat that is directly under the skin but above the muscle. The liposuction will remove that fat and help shrink you down that way. One major issue I deal with a lot of my patients is, are they even ready for the procedure? The first thing to talk about is, well, if you have any big medical issues, we need to deal with that first. If you are too big, we need to deal with that also. Then the other question is, let's say for moms who've just delivered a baby, you need to wait a certain amount of time so that they're not breastfeeding anymore, so that their weight has stabilized. And along that line, I have many patients who have undergone massive weight loss or always want someone to be stable in their weight loss before you consider some sort of a body contouring procedure. Well, who's coming in to see me for these body contouring procedures? It's any number of people, those who have changes after pregnancy, those who have changes after either weight gain or weight loss. Sometimes they're built a way that they're not happy with, or they see that with time, their body's changing and they want to do something about it. Using these traditional ideas of what liposuction is good for, what tummy tucks are good for, you have these perfect patients. Traditionally, the perfect patient for liposuction is someone who has a lot of fat underneath their skin but above their muscle, and has very good, thick, elastic skin where you know that when you remove the fat underneath the skin's just gonna shrink right back down and hug their body, shrink wrap their body to give them a nice, tight, beautiful contour. On the other hand, the perfect patient for a traditional tummy tuck is someone who has both a lot of loose skin and loose abdominal muscles, but does not have a lot of fat underneath the skin above muscles. That person with loose skin, loose abdominal muscles, perfect patient for a tummy tuck. A really common thing though is a lot of people don't fit that perfect mold of just that perfect lipo candidate or a perfect tummy tuck candidate. We have so many more people who have loose abdominal skin, loose abdominal muscles, but they also have a good amount of fat underneath that skin. Either one of the procedures is going to leave them lacking. So what do we do now? We combine it all, and we'll do a good comprehensive liposculpting, liposuction procedure to remove the fat of the abdomen. And then we'll do a tummy tuck to remove the skin and tighten up the muscles. I'm confused. What? So liposuction isn't a tummy tuck, tummy tuck's not a liposuction. What are these things? Liposuction in its most basic definition is this. You take a thin metal tube, you put it under the skin, and you remove the fat that is under the skin but above the muscle. That's gonna slim you down and give you a nicer contour, removing the fat that was maybe hiding that contour before. In contrast to liposuction, a tummy tuck works on actually two different things in the abdominal area. A tummy tuck will remove extra skin and tighten the muscles of the abdomen. Those are two different approaches to the same area, but two different approaches that deal with totally different components of the area of your abdomen. Can these procedures be done together? So the answer traditionally has been kinda, in the sense that we could do a tummy tuck that would focus on the front of your abdomen, and it was okay to do a little liposuction on the sides away from the area of the tummy tuck, because there were some concerns that it could cause problems together. But my favorite evolution in pretty much all of the area of body contouring surgery in the last decade is now that we put them together and we meld the benefits of the liposuction by reducing the bulk of the area with the benefits of the tummy tuck, which removes the extra skin and tightens the muscles. Combining those two gives the absolute best contour of the abdomen, slimming it down and shrink wrapping everything into a beautiful, beautiful shape. Obviously, a super important question is, what is the recovery like for these procedures? And that absolutely varies across the spectrum. With my liposculpting procedures, especially those that are done with my patients awake and comfortable, the recovery is actually surprisingly short, particularly when compared to traditional lipo. I'm super careful to cause a minimum of trauma during the procedure to keep my patients comfortable, and that translates to less trauma after surgery, less inflammation, swelling, and pain, and a super short recovery. So many of my patients who have massive liposculpting, they're up and at it the next day, they're back to work in about 2 or 3 days, and all they do is wear a nice compression garment to just hold everything in for 2 weeks. As we go on, when you start adding some skin reduction procedures and things like that, you do get into a more extended or more involved recovery. So traditionally, what I recommend for a tummy tuck, again, on the other side of that spectrum, is a more involved procedure. People with a desk job typically take about 2 weeks off of work in order to fully recover from the tummy tuck. And then we start getting back into more active things like aggressive exercise between 4 and 6 weeks after their procedure. In my approach of using a drainless tummy tuck, I've found that the recovery from a tummy tuck is much, much faster. And I think the reason for that is that it takes tension off of all the skin, and it actually helps support this repair, allowing my patients to get up and at it and get upright, get more comfortable much more quickly. What if you're thinking about having a baby after the procedure? It's a really important question. I think with a tummy tuck, my general approach is, if you're gonna have more kids, just wait and get the tummy tuck when you're done. And the reason is this: think about what a tummy tuck does. It will tighten your skin and it'll tighten your muscles. Well, if you have another baby, guess what? Who's gonna stretch that out again? The baby will, and you're gonna be put back exactly where you started, and actually sometimes in a bit more of a difficult place where it is challenging to do a tummy tuck after you've already done it. If you have a tummy tuck, are you not allowed to have a baby anymore? Absolutely not. I've actually seen people who've had tummy tucks have a baby and do fine afterwards. But why risk it? If you know you're gonna do it, just wait. I'm not going anywhere. I'll take care of you afterwards. Can I at least get lipo? Because, you may not have kids for another 6 years. And yes, actually you can. Lipo is a different story. Remember, lipo addresses the fat underneath the skin above the muscle. And that's not really altered by a pregnancy, and that will not influence your pregnancy. So for people who want to get liposculpting before pregnancy, I think that's totally fine. Are there other options out there for me? There are other non-invasive techniques and procedures for liposculpting. Some of them are things such as sculpture, cool sculpting, M-Sculpt, among a host of others that, have been out there before and will be out there after I do this video. Those are procedures for people who want 000 downtime and are willing to undergo multiple rounds of treatments to get a modest result. And that goes back to one of the things that I always talk about with any procedure I do. There is no one absolutely right answer for a single person. It's always a combination of things where you're looking at your lifestyle needs, your physical needs, your personal needs. You throw them all together and you pick out what is the best solution for you. All right, I love talking to you about this topic. It's very near and dear to my heart. I want to ask you a favor now. Tell me about what procedures you want to learn about, what else you want to know about in the world of plastic surgery down in the comments below. Also, look, it's really important. Be sure to like this video, subscribe to my channel. We're gonna show you so much more great stuff ahead. I love talking to you about this stuff. I look forward to the next time.